Welcome to 843 TV. We are excited to bring you our first show of the new year. And joining us today are two very important guests, going to talk about some important and vital things that we've got going on in our community. So first up, we have Dr. Raymond Cox. He is the Executive Director of the Volunteers in Medicine. He's going to share all about the important resources and services they offer to our community. Also, we have Dr. Jean Frew with the Outside Foundation, going to talk about the special Kids in Kayak program they've got and a special event coming up in March. So you don't want to miss it. Stay right here for this episode of 843 TV, where communities come to speak.
.843 TV, where the Lowcountry comes to speak.
.843 TV,
where communities come to speak.
Welcome to 843 TV. We are excited for our first show of the new year, 2021, and our guest this morning is Dr. Raymond Cox. He is the Executive Director of Volunteers in Medicine, also known as VIM, and he's going to share about all the vital services that they do for our community. So great to have you. Good morning.
Thank you, Lisa, and thank you for inviting me.
And today we're going to be talking about a couple of things, just an overview of VIM. For us who live here, it's a pretty well-known household name, but there may be some folks out there who don't realize all of the services that you have to offer. So we're going to talk about that as we start. So share with us the vision, the mission of VIM, and who you service.
Thank you. Yeah, Volunteers in Medicine has been in this community now since 1993. We just got finished celebrating our 27th anniversary. This is our 28th year. Our mission is to understand and serve the health and wellness needs of the medically underserved and their households who live or work on Hilton Head and Daufuskie Island. This program is a brainchild of Dr. Jack McConnell, who retired here in 1989, failed his golf retirement, and then started looking around for something meaningful to do, and noticed that there were a lot of people on the island, particularly low-income service workers, who didn't have access to health care, didn't have health insurance. And for that reason, he started Volunteers in Medicine. We accept no government funding. We live completely off of the generosity of our donors and through grants. And this community has been tremendously supportive of Volunteers in Medicine over the past 27 years. We are now the largest free and charitable clinic in the state of South Carolina. We average 27,000 visits a year. And we now have 92 other clinics around the country that are based on the Volunteers in Medicine model. To your point about people not knowing about Volunteers in Medicine, a lot of people have heard the name. The thing that always amazes me is when people come in for tours, they really don't have a sense of just how many services we provide. We have over 650 volunteers and about 110 physician volunteers representing 23 medical specialties.
Wow.
We had a very active dental program and mental health program as well. So it really is a very comprehensive one-stop shop healthcare service for people who are most desperately in need of it.
How does someone go start the process of, if they need the health care, what should they do first?
So the qualifications for Volunteers in Medicine is that you need to be uninsured or underinsured. You need to live on Hilton Head or Daufuskie Island or work on Hilton Head or Daufuskie Island. So you have to have either proof of residence or proof of employment that includes working here on the island. And then, of course, you have to be at 200% below the federal poverty level, which for a family of four is about $48,000.
Okay,
annually.
So then they can, that's the qualifications, then they can get started and they just call, they need to, how do they actually get to you to be seen? So
we have a website, www.vimclinic.org.
Okay.
They can also call our main number, 843-681-6612. Many of our patients used to walk in. Since the pandemic, we don't do walk-ins anymore. And in fact, we really haven't been able to accept any new patients because we're trying to protect not only our patient population, but also our volunteers, most of whom are over the age of 65. So we've been very, very careful about making sure that the clinic is clean constantly, that everybody is wearing masks. In fact, we have a box of masks at the front door, so if somebody comes and doesn't have a mask, they are given one. We do temperature checks when they walk in the door, and so we have a very detailed system for making sure that we're keeping our patients and our volunteers as safe as we possibly can.
Now, of course, this past year in 2020 with the pandemic, I'm quite sure has changed the way you do things and the greater needs. So let's talk about that, and then we're going to get into the special project that you all have underway. So how are some ways that you all have seen the need grow in lieu of the pandemic in this past year?
So one of the reasons we really haven't we understand that the need has grown because a lot of people have lost their jobs, particularly in the food and beverage industry. Unfortunately, we haven't been able to meet that increased demand because we have a reduced number of volunteers. We also have had to close the clinic or reduce services through the clinic. One, as I mentioned, is that we're not accepting new patients. We hope to reopen that next month in February. And the other thing is that we're not accepting walk-ins. We plan to address that through a telehealth program, which we're currently setting up, that we're really pretty excited about, actually, so that people will be able to call in, ask physicians questions, and limit the number of times they actually have to come into the clinic. We have, even when we closed down for 9 weeks in the last half of March, April, and May, we still provided prescription services. So we did several thousand prescriptions during that period of time, and a couple hundred telehealth visits as well. We had to close down as well during this recent holiday season, again, because of our concerns about surge in the number of cases. So we just reopened for full services on Monday. We hope that we won't have to close again, and have been actively involved in helping the hospital and other community members with creating a vaccination plan that will allow us to increase the number of vaccinations in an efficient manner as possible.
Let's talk about the special project you have going on, Project Isolate Safe. Share with us what that is.
So Project Isolate Safe was a brainchild of the Greater Island Council through the medical committee, which is chaired by Mark O'Neill, who used to be the chief executive officer at Hilton Head Hospital. He has retired but has remained active in the community. The Greater Island Council was very concerned about making sure that we have adequate health care services on the island for everyone, not just for people who can afford it, but for some of our low-income workers which have difficulty accessing services. So we've been looking for ways to be more efficient with that. One of the things that we had to do once the pandemic showed up was to turn our attention to how we can best serve that community. So Project Isolate Safe was one way of helping to reduce the spread of the coronavirus by taking someone, once they're COVID positive, and either taking them giving them the opportunity to come out of their home situation, particularly if they're in a multi-generational household, or if, like what happens in the food and beverage industry quite a bit, where you have several roommates living in the same domicile.
Right.
So we just started this project on January 4th. We actually got our
brand new then.
Yeah, it's pretty brand new. So we've done a couple of things. One is we have identified some apartments where people can isolate safely. We also are providing COVID boxes, which have personal protective equipment, thermometers, pulse oximeters, other things that will help them, as well as a fairly large packet of educational material that you have a copy of there. So that gives us two options. One is if the person wants to isolate in an apartment, or if they decide that they want to isolate at home, these items in these boxes will help them do that more safely, as well as provide education. Deep Well has been a tremendous partner for this program, and has offered to provide food boxes for anyone who tests positive, and in order to keep them at home rather than having to go to the grocery store,
Right.
they will provide food boxes for them and their families.
This has got to be an even more tremendous challenge with the housing. The housing is already a challenging issue in our area. So to have to find housing for this purpose has got to be difficult.
It was pretty challenging, yes.
Yeah. Who are you working with the housing? Is there any, to help you with finding these apartments or temporary housing to help these patients? Is there?
So again, Mark O'Neill really was took the lead on identifying this housing. The people who are providing the housing do not want to be identified. They don't feel that they need the publicity. So, but like I said, we're very fortunate that we were able to find some people who are willing to do that.
Well, you have been very educational to me and to our viewers today, and I hope that anyone that has any questions can feel free to contact you.
Absolutely.
And contact them, and their number and website will be on our screen. And we just want to thank you for sharing about this special project and just for everything that you do for the community and all the years that you've served here. So Dr. Cox, thank you. And thank you all for watching 843 TV. We'll be back with more.